Welcome back to another episode of Your Palm Beach Guide, the official podcast of the Palm Beach Chamber of Commerce, where we bring you conversations with the leaders, innovators, and experts shaping our community. Heart disease remains the leading cause of death in the United States, but thanks to incredible advances in prevention, screening, and treatment, patients today have more options than ever before to protect their heart health and improve their quality of life. Today, we're joined by Dr. Brijeshwar Maini, an interventional cardiologist at Good Samaritan Medical Center, to discuss some of the latest innovations in cardiovascular care, from understanding the atrial fibrillation and how the WATCHMAN device is helping reduce stroke risk, to the growing importance of preventive cardiology, coronary calcium scoring, and advanced technologies that are transforming complex heart procedures. We'll explore how these advancements are helping patients live healthier and longer lives. Dr. Maini, thank you so much for being on the podcast.
All right.
Dr. Maini, welcome to Your Palm Beach Guide.
Thank you for having me, Kiana.
Listen, I'm so pumped to talk to you just about everything that you're doing, especially you said you were just doing a WATCHMAN surgery as well.
Correct.
So I'm excited to talk about that. But for those who don't know you, just share a little bit about who you are and how you got to Palm Beach County.
Perfect. So first of all, I'm a local.
Oh, good.
I
Okay.
actually live 5 minutes, maybe 10 minutes away from here.
Great.
So this is home for me.
Good.
And I've been working here in Palm Beach County for the last 11 odd years.
Oh, wow.
And I'm an interventional cardiologist by trade. So what I do is I fix rusty pipes, broken valves, those kinds of things. You know, the only difference is, in my case, the machine's still working and cannot turn off.
That's true. That is very true. What point in your life did you know you wanted to go into this profession?
Oh, good God, that's a very long story.
Yeah, shorten it for me real quick. Just give me a summary.
So the summary is I never wanted to do clinical medicine. I wanted to be a lab rat. I wanted to do inventions. I wanted to find the cure for everything. You know, it didn't happen. So I wound up being a clinician, and I've been a clinician for, good God, 35, 40 years. I've been in this business since 1985.
Wow. Wow. That's a long time. Well, I want to specifically talk about AFib, and I want you to share, just for people who don't understand, what exactly does that mean, and give us just the summary of what it looks like.
So atrial fibrillation, what most people think of is an electrical abnormality in the upper chambers of the heart. So instead of one pacemaker, we all have pacemakers that initiate the electrical impulse to begin with, and that spreads over the upper chambers and eventually goes down to the lower chambers, which results in mechanical activity. So think about this. It's a mutiny in the upper chambers. So instead of one principal pacemaker, you got 500 of them who want to take over. So all these pacemakers are now firing, which results in some of them get across to the lower chamber, some of them don't. So the ones that get down, so it becomes irregular.
And does
So-
that then increase your risk for a
Right, so
stroke?
it's the irregularity, that's the electrical disturbance, which is atrial fibrillation. But there's a lot more to it. The electrical disturbance is what we see on face value. The problem is with the atrium,
Okay.
the upper chambers of the heart. So we call it atriopathy. It's a dysfunction of the upper chambers of the heart at a cellular level, which is resulting eventually in the electrical dysfunction, which results in no mechanical function because there's a mutiny. So the electricity is firing, but it's not resulting in any mechanical activity. Since there is no mechanical activity, as you know, when blood is standing, what's going to happen? It's going to clot. That's how clots form in people who have atrial fibrillation, which is why it is the most common cause of large strokes is atrial fibrillation, is because of clot formation with the upper chambers are not pumping.
Can a stroke happen at any age, or is there a specific time frame for people?
Strokes happen because of a multitude of reasons, not just one.
Okay.
Right? So there's hemorrhagic strokes. You may have heard about bleeding in the brain. Then there's ischemic strokes, which is because of a clot went from somewhere else and clogged the blood vessel. Or you could have de novo plaque buildup inside the blood vessels in the brain, which could also give rise to lack of blood supply to that portion of the brain. So you have ischemic strokes, you have hemorrhagic strokes. So both of these can happen at any point in time, even at a younger age. And there's different reasons. Pediatric strokes are different. You know, as you get into more adulthood, it's because of plaque buildup, it's because of atrial fibrillation, and so on and so forth. So multitude of reasons as to why people have strokes.
Okay. So the WATCHMAN procedure has gained a ton of interest. So tell us
Correct.
a little bit about that.
So much like what I was explaining to you, there's no mechanical activity. So since there's no mechanical activity, much like the appendix in our belly, everybody's heard about it. There's a similar appendix in the upper chambers of the heart.
Oh, okay.
Now, the good God designed this chamber. It's a pressure transducer. It's the thinnest part of the upper chamber of the heart. So if there's more fluid in the body, we drink too much water, it distends. When it distends, it sends a signal to the brain saying, hey, you've drunk too much. It's time to make some pee, okay?
There you go.
So as a pressure transducer, it gives the signal to the brain, and that's how we function as a human being, right?
Right.
Now, since it's a real outpouching, it's the most distant part, and it's thin-walled, it's got lots of trabeculations because it's a pressure sensor. 95% of clots in patients who have atrial fibrillation happen in that outpouching.
Oh.
Those clots can then come out and wind up in different parts of the body. Of course, it winds up in the muscle and bones. It is a big deal. It's not that big of a deal. And a small clot goes in the brain, you wind up with a stroke. So 95% of clots in patients with atrial fibrillation form in the left atrial appendage, which is a part of the upper chamber of the heart, which is why people are on blood thinners to prevent strokes.
That makes sense.
For the longest time, we were giving people Coumadin, which is rat poison, and now we've got much
Do you
better
remember
drugs.
those commercials that were like, and then it lists out all of the things that
Yeah,
it could
yeah,
give
all
you,
the-
and it's just so negative, and you're like,
Right.
why would you ever take
Why
this?
would you want to take that, right?
Right.
Well, so we've got better drugs now, and these drugs are certainly a huge improvement to the old Coumadin that we used to prescribe. But nonetheless, blood thinning is blood thinning. There comes a time when anything good turns bad. So people fall down, they're in a traumatic accident, you're bleeding, you're having GI bleeds, and so on and so forth, other ailments. Now suddenly you become a high-risk candidate for blood thinning. If you're a high-risk candidate for blood thinning, we can do this procedure, i.e., if we shut off that pouch,
Yeah.
we decrease the risk of stroke by 95%, because we just said the risk of having a stroke is 95% of clots form in the left atrial appendage. So I shut that off, close off that room, I shut the Pandora's box
Yeah. You do.
opening, you just shut it, now we're good. So all the trials that we've been doing, and I have had the luxury of being part of these trials since 2005.
Oh, a long time. Okay.
Yes, I've been doing this for
Well, yes.
dog years. We've been able to prove that if you close the appendage with a left atrial appendage closure device, WATCHMAN is one of those devices, you decrease the risk of a stroke as if you were on a blood thinner, and there's actually a mortality benefit. The mortality benefit is not because of lack of strokes. The mortality benefit is because of lack of bleeding and the need for transfusions. So this is a huge game changer for people who have atrial fibrillation.
And are they typically coming into the hospital for some other reason when you find this?
They come in for atrial fibrillation, or they come in for other reasons, or they come in with a bleed, and we realize, hey, Mrs. or Mr. XYZ,
Right.
you have atrial fibrillation. We think you're a high-risk candidate for it. Here's a possible option for you.
And then it becomes a whole different conversation at that
Depends
moment.
a whole different conversation. And the good thing is that we do this in a very multidisciplinary approach. So it's not because I can do appendage closure device, I'm going to prescribe it.
Right.
The whole team has to agree that this person is a good candidate. We think this person will benefit from it. And then if we all think this is a great thing, then there's certain tests that we do to make sure that you are anatomically a good candidate.
And what's the timeline look like for that?
So if somebody comes in, it's usually a few weeks.
Okay.
You never do these procedures as an emergency.
Right, yeah.
These are prophylactic procedures. You're not ill. You're not sick. We can't have you sick.
Oh, yeah.
Something
and then
bad's
do-
happening, and
yeah.
we're doing this. So you're well. You're an outpatient. You come on in. So that's why a lot of attention has to be paid to detail. How much benefit do we think you're going to achieve by doing this, and so on and so forth.
So a lot of patients have a concern with the amount of recovery time. Let's say they move forward with this.
Correct.
And they move forward with this process. What can they expect before, during, and after they decide to do the WATCHMAN procedure?
So first of all, it's a very simple procedure. There's no cutting involved.
None.
Nope.
Oh,
So there's a small access in the vein, much like people have had their veins cannulated for whatever reason to get blood and all. This is a slightly bigger catheter, which goes in the vein in the groin.
wow.
There's no arterial puncture. Veins are low pressure systems, so the risk of bleeding becomes even less. There's no other puncture, there's nothing. And then through that, and I'll show you this.
Yes, tell us
This
about
is-
what this is.
So this is a mini version. It's obviously longer because you
Right.
won't reach the heart through this,
Yeah.
right? And I can steer this. So I go up from the groin and I push it up. I go into the right upper chamber of the heart. When I go to the right upper chamber of the heart, now I got to cross over to the left side.
Wow.
So with this, there's a technology, you can use radio frequency energy to make a small hole in the septum, which is the interatrial septum, partition between the right upper chamber and the left upper chamber. Once I cross, then since this is multi-directional, I can guide myself on ultrasound
Oh, wow.
and I can see that pouch. So we measure the pouch on CAT scan, we measure the pouch on echocardiography, because these devices, this is the device, one of the devices. They come in different sizes. The shape is the same. Okay, just think about this.
So it's like a round shape for those, who can't see us with like
right. So this would be
metal.
some, yes. So this is covered with PTFE, polyester.
Yeah.
Right, and this is circular right now. But what will happen is the appendage ostium or the opening is not circular. So, but this is very pliable. I can squish it.
Oh, wow.
So this will take the shape and size
Of whatever you put it
or
in.
whatever you put it in.
Yeah.
Right. So it could sit like this,
Wow.
or it could sit the other way around. Right.
Right.
So you go in, and this is loaded in here, and then all we do is we extrude this out. See how it's coming out? I hope the viewers will be able to see this if I do it like this.
Yeah.
And I pop it in, and then I unscrew it. If I don't like it, I take it right back, and I position it
And
in the
then
right
you-
spot.
So does that stay?
yeah, so
that
once we're
stays.
done, you see this knob here?
Yeah.
I just unscrew it,
And
and then you
Oh, wow.
release it, and then it stays. Everything else comes out.
right.
Only this stays behind.
Got it.
Right? You can't send it home with this thing hanging
Yeah,
out.
oh my
right?
gosh.
that won't work very well, right? So think about this. So the appendage is here approximately, right?
Right.
This is covering. People can see.
Yep.
And this is closed. So if the clots were supposed to form here, if you would, they're stuck here. We don't care what happens here. It's
Right.
shut off.
Right.
That's how you decrease the risk of stroke by 95%.
That's incredible. That is incredible. And so the recovery time for patients
So,
who do
so
this.
let's talk about the procedure itself.
Yeah.
It does require general anesthesia, not because we need general anesthesia for doing the device. The only way we can see it is with a special ultrasound. It's a probe that goes into the esophagus.
Oh, okay.
So you have to put the patient to sleep not because of procedure, but because visibility is through that ultrasound.
Right.
My time for the procedure is about 35 to 40 minutes, which is not that long.
Yeah,
right?
that seems oddly short to me.
It is, right? Sometimes it's even shorter. Sometimes it can be longer too, right?
Right.
The patient's time on the table is about an hour and a half, because you got to bring the patient in, put them to sleep, clean, prep, drape. We do the procedure, and then people go on and
Right.
recover and so on and so forth. Overnight stay in the hospital.
Okay.
We don't have to, but it's in the abundance of caution. Make sure everything's fine.
Absolutely.
And so on and so forth, right? And then they go home the next day.
Wow.
And like I said, there's no incision, there's no cutting. This patient that I just did is going to sit up as soon as the person wakes up, and they're going to eat and drink,
And just
as far as they're
carry on.
concerned, it would be like getting an endoscopy, a colonoscopy, and you're fine.
No, wow, that's incredible, because some people think that you're out for X amount of days or, all of
No,
those things.
no,
And that
no.
prevents people from moving forward with
Correct,
that type of
correct,
procedure.
correct,
So,
correct.
and the fact that it increases the mortality rate, like you mentioned, that
Correct.
is a
Right.
no-brainer at
The
that point.
bleeding complications from the blood thinners, which increase bleeding, result in increased mortality. People don't realize
Right.
the act of getting a blood transfusion itself results in increased mortality. So if I take two groups of people, a group of people got blood transfusion for whatever reason, we don't care what, and the other group did not, these people are going to have a much higher mortality than these people.
What would you say, just because I think of my own family, like I think my granddad has been on blood thinners for ever, it seems.
Right,
Like,
right.
what would you say to people of that age demographic that maybe is still operating off of like the brain of, oh, I'll take Coumadin and it'll be totally fine. How do you get people to understand
so there's
that?
two things which are very important, and I think for the viewers this is very important.
Right.
We are only talking about blood thinning for atrial fibrillation.
Got it.
There are other reasons why people's blood needs to be thinned. Like, for example, somebody may have metal artificial heart valves. You cannot take the newer fangled blood thinners. You have to take the old Coumadin.
Ah, got it.
You're
Okay.
stuck, right?
You're stuck, yeah.
There are certain hematological disorders in which you have to take Coumadin, because there's been no studies with the newer drugs, number one.
Right.
And, it's just one of those things that you cannot do, right?
Yeah.
There are certain other things, situations in the cardiac pathological states that you cannot take the newer ones. You have to take Coumadin. Sometimes people have clots in their legs. which
Yeah.
go into the lungs, you have to be on a blood thinner. So putting a WATCHMAN in somebody that had pulmonary embolism or a clot in the leg that wound up in the lungs, this thing is not going to help,
Okay.
right?
Right.
So people have to understand, just because you're in a blood thinner, left atrial appendage closure with a device like WATCHMAN, and there's another device called Amulet, is not going to cut it.
Yeah.
So that distinction is very important to
Yeah.
understand.
No, that makes sense. So I want to transition really quick because Good Sam has launched its Center for Preventive Cardiology. And I want to specifically talk about that. What is preventive cardiology and why has it become an important part of heart care?
So I think the first of all, let's talk about the definitions.
Yeah.
What is primary prevention? What is secondary prevention? So the easiest way of understanding is the patient has not had an event,
Okay.
not had a heart attack. Secondary prevention is you already had the event. We're trying to prevent you from having a second one. And
Right.
secondary, primary is you may have heart disease. We may have found plaque in your heart arteries and so on and so forth. We want to prevent you from having a sentinel event.
Yes.
We want to prevent you, A, from dying, first of all, right?
Right.
And B, even more importantly, from time to time, obviously mortality is the trump. You know, there's nothing bigger than that, right? But we also don't want people to have a heart attack, wind up with poor hearts, and you have heart failure and all those complications that follow and so on and so forth. So we want to catch people young. We want to find out before anything happens. We want to catch people so early. That's why people are even talking about doing cholesterol levels as teenagers in their 20s. A lot of people are on cholesterol-lowering drugs in their 20s.
Oh, wow.
And so that's number one, which I think is a good thing.
Yeah.
The more important thing that we have to understand is that atherosclerosis or plaque buildup is an inflammation.
Okay.
Not like bacterial inflammation, but it's
Right.
an inflammatory process. We now have access to certain special kinds of cholesterol testing, which really runs in families. It's genetic. It's not what you're doing. You could be exercising like a fiend. You could be living the best life.
That's good to
and,
know.
And you wind up with a heart attack by the time you're 42. And guess what? Your father had a heart attack at the age of 42. And we've got tons of those kinds of people, right? I did everything right. Why did this happen to me? This happened to you because you had those genetic issues.
Already.
We need to find out about those things now. And the good thing is now we have treatments for it.
Wow.
In the days gone by, we never did. So finding these patients appropriately, we're not going to go doing this testing on everybody, but
Line up, everybody.
right. But an appropriate patients, you got family history, you got risk factors. We want to catch you sooner. So if you're hypertensive, you're diabetic, you have high cholesterol, you get a calcium score. CAT scan takes 10 seconds to do. We know if you have plaque or not. It's
that's
a
quick.
very good beginning. People, live screening does it. You can almost get
Yeah.
it done for free, right? Almost, right?
Right.
Get that done. Make sure your blood pressure is good. Make sure you're not a diabetic. Make sure you're exercising. Get your cholesterol profile done. That is
For your-
primary prevention.
For your cholesterol profile, can you get that done pretty much when you go get your physical
Yes.
or anything like that?
Anything. So not the full-blown inflammatory markers that I'm talking about, the
Right.
basic stuff.
But just get the basic stuff at least to
get the
start
basic
somewhere.
stuff, and then your physician should know what risk factors you have, and based on that, I'm not going to do a CAT scan in a 20-year-old. Not going to happen, right?
Yeah.
But if you're 50 years old, you have a higher stress job, you have premature families, you have heart disease, your cholesterol's not so great, I'm going to do that.
That makes sense. Talk about calcium scoring.
So calcium scoring is one of those things that has been around for a very long time, and people really did not know what to do with it. It has no prognostic implication. What is calcium? Everybody has plaque, or most people have plaque. Everybody makes plaque, right? When that plaque ruptures, it heals with the deposition of calcium. Like you cut your skin,
Right.
there's going to be fibrous tissue that's going to grow in, or people have scars, right? It's scarring.
Right.
So scarring is with the deposition of calcium, which is what the CAT scan picks up. That's it. It's a very simple thing. That's why I'm
Wow.
saying it takes 10 seconds.
Right.
There's no fancy thing to it, right? So what that tells us is you have, you have plaque, B, you've had plaque rupture.
Oh, wow.
That's not good. So there's gradations. Less than 100, minimal. 200, more than 100 to 400, moderate. More than 400 is severe calcification.
Got it.
So if you have a 50-some-year-old patient who comes in and has a calcium score of 500, that is a patient I'm going to do inflammatory markers. I'm going to make sure you're not a diabetic, make sure you're on a statin, and there's certain new drugs like Repatha and Leqvio and all those things. Based on the inflammatory markers, should you be on it? Do you have other genetic markers for it? It's a very good screening tool for us to say there's more to it than meets the eye. So let's be a little more aggressive about it.
Right, exactly. And when they come to you, and again, it's patient by patient, it seems. It's very, of course it is. But when you talk to that patient and you say, here are the next steps to help with that, do you recommend the WATCHMAN type thing, or is it something
No, so WATCHMAN is for atrial fibrillation.
Atrial, right.
So this is for a regular, healthy, going on middle age kind of a situation.
Yeah.
For primary prevention.
Got it.
So look at this. Then usually would get an echocardiogram, make sure the heart squeeze is good. Doing an exercise stress test in this patient population that I'm talking about is a good thing to see what your exercise tolerance is like.
Okay.
This is something I want to touch on.
Yeah.
Exercise is extremely important. Physical activity for at least half an hour a day or at least 5 days of the week should be an integral part of every human being's life.
I'm glad you said that. Say it again for the people in the back.
Yes.
Like, come on, guys.
Half an hour every day. It's not a big deal.
Right.
And I tell patients, I don't care what you do. Go for a walk, go for a swim, go for a bike ride. Do something. Do Pilates. Something.
Right. Something.
Move a little bit, right?
Exactly.
If you move, there's a higher likelihood you're going to have more longevity than if you don't.
Exactly. No, I love that you say that because I think people overcomplicate it. It's not like you have to spend 2 hours in the gym.
You don't have to.
And all these other things. It's like if you can't make it, just get outside and do it.
Go for a walk outside. It's not the end of the world.
That's so true. I love that you say that. So specifically for Palm Beach residents, I want to talk on our local market here who may have had a family history of heart disease. How would you advise them on the next steps to take if it's in their family history? Like if you're talking to a 30-year-old or 40-year-old who maybe are just like, well, I think my grandma had it or my mom may have had it. What does that look like for me?
So extremely simple. You look at risk factors and everything's available online, right? Do you have high blood pressure? Do you have diabetes? Do you have high cholesterol? Do you smoke? And I'm going to put vaping into it.
Good, you should. Let's talk about that. Right. So let's talk about vaping.
Vaping is more horrible than smoking. I mean, they're both bad, right?
Yes.
They're both equally bad, but vaping is probably even worse.
Wow.
Right?
Yeah.
People don't get it.
People don't get
You
it.
need to stop this, okay? Vaping, alcohol, right? Well, I'm going to say something about THC as well.
There you go.
None of that stuff is good for you.
Right.
Just because it's now legal doesn't make it good, right?
I love it.
So all these things, when you look at all these things, and the other thing I want to talk about is, metabolic syndrome. Okay. Metabolic syndrome is you're out of shape, you're unexercised, you're overweight, your BMI is through the roof. You're a setup. So you may not have overt diabetes yet, but if you have metabolic syndrome, you're obese, you're a setup. So everybody should look at, these are the main risk factors we're talking about.
Right.
Then you go to your family doctor, you go to a cardiologist, whoever, somebody who is knowledgeable about these things, who will then evaluate you as to what truly is your risk at this point in time. That will also include a basic blood work, your cholesterol levels, and so on and so forth. And then you take things from there. Depending on how many risk factors you have or not, then I would suggest, okay, now let's get a calcium score on you. Let's make you walk in a treadmill. If your cholesterol levels are high, especially if you have more inflammation, what do we need to do for you to prevent you from having your first heart attack by the time you hit, for a 40-year-old, hypothetically. By the time you're in your 50s, we don't want you to have your first heart attack, right? I'll give you an example. I saw this 63-year-old executive, and this person came to me and said, I'm the fourth child. Sibling number 1, sibling number 2, sibling number 3, they've all had open heart / stents, one of the above. They all had them.
Wow.
And I'm very well exercised. I do everything right. I've never smoked. I've never done anything. And you look at this person, the picture of perfect health, right? So I said, so how has it been coming along recently? Well, I used to run 5 miles. Now, I get tired at 3.5 miles. Big sign.
Okay.
This person, horrible blockages.
Really? Oh, that would kill me if I heard that.
Right? Now,
I feel
this is the person that needs aggressive treatment,
yeah. Wow.
such that she doesn't wind up with. No, the good news is this person did not have a heart attack, right?
You're right.
Now, this is where the kicker comes.
Yeah.
This person came to me at the age of 63. This person knew for the last 15 years she's a setup.
Mm-hmm.
Just because you're the youngest kid doesn't.
I know, you're like, that
absolve you.
justifies it.
Right. Oh, I saw those old guys, and I'm the youngest.
Right.
It's not going to hit me.
Right.
This person should have had that primary prevention at the age of 52. Should have been on a statin. Should have had, 10 years ago we didn't have those tests, but nonetheless.
Right, but now
But
it's
now
there.
we have them. So this person, if I was to look into my crystal ball, I would have said, 14 years ago, this is what you should have done. And maybe all those blockages that we're seeing may not have
Been
to be
here.
fixed.
Right.
Or at least they would have been there, but we wouldn't have to do anything about it.
Right. So as we close really quick, what would you share with our listeners, whether they're 30 or 40, about the preventative setup? Like, what do they need to be paying attention to? And just what is their first step?
Don't smoke, don't vape, drink in moderation, exercise. These are the most important things
Very
in my
simple
mind.
things to do.
Very simple things,
Simple
right?
things.
I'm not telling anybody anything different,
Right.
right? Get your physicals done. Get your blood tests done. If you have family history, a little more,
Yeah.
right? And pay attention to your body.
Pay attention. That's so
Pay attention.
good.
We're all mortals,
Yeah,
right?
that's true.
And bad things don't only happen to other people.
Right.
You are the other people.
Yeah, I know.
Not the other people,
That's true.
right?
That is so true. I love it. Well, really quick as we close, I have some rapid fire.
Of course.
They're really fun, so
Okay.
they're not super intense. But what is your go-to morning order? Do you drink coffee or tea, or you just a water guy?
I'm spoiled. I have tea in my bed at 5 o'clock in the morning.
Nice.
I will not get out of bed without that.
That's amazing. What kind of tea? Like black tea, Earl Grey?
No, I drink.
Matcha?
I drink tea with a spot of milk in it.
Nice. That sounds amazing. What is your favorite hidden gem in Palm Beach?
You know what? I exercise in a gym which is very close to my house. So
That's
it's
the
very
best.
cheap gyms, and I go there 6 times a week.
That's good.
I work out for an hour, 10 minutes.
Good.
And I do half an hour of aerobics, and I do about 40 minutes of weights,
Weights. Good. Very good.
which is also, I
Oh,
want
yeah.
to
Let's talk
emphasize
about
on that.
that.
Very important, right?
Yes.
So each one of them in their own right is not good. I mean, they're good, but,
Right.
but you got to complement that. You got to add aerobics to weightlifting or muscle training.
Right.
And if you're doing the other way around, then you got to do the other way around. And especially as people grow older, we all lose muscle mass. We lose bone density. So weightlifting and muscle training is a very integral part to keep your bones and joints in order.
Can I tell you, I love this whole resurgence of the importance of weightlifting that's kind of happened
Yes.
in the last 10 years or
Yes,
so, because
yes.
before it was so taboo. You were like, especially for women at least, it was like, you're going to get bulky and you're going to look like a man and it's going to be like so
No.
crazy. And it's like, I'm so glad because I lift all the time. And I'm like, people should be lifting weights. Why? Like,
Yes.
thank you for finally society
it's
realizing
extremely important. And like, for example, let's talk about leg presses,
Yes.
right? So if you are 60 years old and you cannot get up from a sitting down position without holding onto something, by the time you're 75, you'll be in a wheelchair. Now,
See?
this may be a little bit of an overstatement, but
That's important,
but
though.
that's
So
important,
many
right?
people don't pay attention to
Correct.
those little things, and
Correct.
it's like functional fitness,
Correct.
like carry your groceries up the stairs,
Correct.
walk up the stairs
Correct.
without groceries, all of those things.
Correct.
So I really love that you said that because I'm a huge advocate for that. So thank you. And one other question: what is one book that changed your life?
oh, good God, that's a difficult question, You know what? I don't read.
You don't read.
Ever since social media came out and the internet came out, I just read online.
Okay, well, you still read then. It's
Yeah,
you know,
I still
articles
read.
and things. And last question: what is one piece of advice that you would give your younger self as you navigate life in the workplace?
Work less hard.
Okay. All right.
Pay attention to life because life passes you by. So my kids are older. My son's going to be 30 years old. And I still remember the time when my children were being born or were born, and there used to be an old Buick commercial. You were probably not even born at that time, where the couple are driving, the kids are sleeping in the back. And I would always wonder, that I'd do that. And we did that, right? And that Buick commercial still stays with me. And my mother, may her soul rest in peace, would always tell me, you need to pay more attention to your children because they're too busy doing what you're doing and they're going to leave the house. My kids have been gone for 12 years.
Wow. Wow.
And it's me and my wife. So if there's one thing I would do differently, I mean, I did it. You know what I'm saying?
You
I'm not
did.
chastising
Absolutely.
myself.
No,
right?
of course.
So I think people need to pay more attention to themselves, to their families. I think this is heart healthy as well.
Absolutely.
Because at the end of the day, there's only a few people that care about you when you really need them, right?
Right.
It's these people.
That's
Everybody
true.
else is going to take out their 3-4 people, right?
Right. That's so good. Well, Dr. Maini, thank you for being on
This
your
is
Palm Beach
absolutely
Guide.
fantastic. Thank you for having me.